Yesterday, the World Health Organization declared coronavirus a global pandemic. One important thing to keep in mind is that 80% of cases are mild. In the more than 70,000 cases that have had an outcome, 94% of the people have recovered. Even so, you may be wondering what this means for life here in Santa Cruz County, and more importantly, what does it mean for you? Our guest today will help us understand the steps that we can take to mitigate the virus, what the risk factors are, what the symptoms are, helpful things you can do to prepare your family, and what you may experience if you get this virus, and much, much more. Stay with us. Hi, I'm Becca King-Reed for CTV with a special report on coronavirus. Santa Cruz has joined the ranks of California cities with a confirmed case, well, several confirmed cases of coronavirus or COVID-19. Joining me now to help us understand our situation is Health Officer Dr. Gail Newell of the Santa Cruz Public Health. Thanks for joining us.
Thanks for having me here today.
It's great to see you, and I know this is a busy time, so we'll get right to it.
Good.
The question on most people's minds is, what does this mean for me? So what is the status of coronavirus in Santa Cruz County? What's our situation now?
It's rapidly evolving here in Santa Cruz County. We announced our first case last Friday evening. We found out about it Friday evening, announced it on Saturday. We're now at 7 confirmed cases in the county of Santa Cruz, so very rapidly evolving. We have a number of persons under investigation as well for testing, with expected more positives.
So I guess it's hard to judge the rate now, and we don't have testing. So what is your projection going forward? Do you have an idea of how this might move forward and how quickly?
We definitely are beyond the containment phase of managing COVID-19 in Santa Cruz County, and the state has made that clear to us and 2 other counties who are in our situation. We are now in the mitigation phase, so trying to lessen the damage that this virus wreaks on our community.
So just stepping back a little bit and looking at the global picture, we've seen that Italy has quickly surged forward with lots and lots of cases. They've closed off their borders, and China is moving backward. So is there anything we can learn from their 2 different approaches? And then is there anything we can really employ from the China approach?
Thanks for asking, and we're trying to learn as much as we can about this virus. It's new to the human species in modern medical history anyway, and there's so much we don't know. We don't even know exactly how it's transmitted or what the incubation period is. We certainly are looking to other countries where we are having big outbreaks and trying to learn from those. I'm also watching my fellow health officers and the resources they're using and actions they're taking. So, for example, in Santa Clara County.
Mm-hmm. Yes. So, as a public health professional, you've handled more kinds of things, nothing like this, but things like this. If you could do anything, if the world was your oyster and you could do anything at all to stop this in Santa Cruz County, what steps would you take?
Well, our biggest deficit now is the lack of availability of testing. We're very limited in testing capacity in the state of California. Our public health labs are only able to do 200 to 300 tests per day in the entire state of California. That doesn't even come close to touching what we need to do just to do case contact investigations. Yeah. So it's an interesting thing with the test. So we hear a couple of things. One thing is, well, if you have a mild case, don't even bother your doctor. He won't be able to give you a test, and it won't matter if you have one. So what is the issue? What do you think when you hear that? That's probably really good advice. As you mentioned in your introduction, 80% of people with this virus, COVID-19, will have a very mild case. So we're recommending at this point that folks just stay home and recover at home. So if you feel sick, it's very important not to go to work, not to go to school, but stay home, rest, and stay well hydrated. We don't have a treatment for this virus at this point anyway, so that's the best initial advice.
So let's talk a little bit about the symptoms of this? Because people have asked me, how do I know if I got the flu or the virus? Is there a way to tell?
It's really hard to differentiate between flu, the common flu, and this COVID virus. They have very similar presentations. They both have fever and respiratory symptoms. However, the flu symptoms tend to be up in the head, what we call upper respiratory symptoms, so sniffles, sore throat. This coronavirus has more lower respiratory symptoms, so cough, wheezing, shortness of breath are more common. Fever is present in almost every case.
So someone in your family gets it. Now what do you do? Now you've got someone in your family, and it seems, so let's step back a second before you answer that question. How contagious is it?
This is not as contagious as measles. It's not airborne. It doesn't go through vents. So nothing like measles or chickenpox. It's more like the flu. So it's spread through droplet. So you and I are within 6 feet of each other. We're facing each other, even though we're not intending to. We're sharing droplets. So if we're here at this time, especially for longer than 2 hours, closer than 6 feet, that's a close contact, and we're at greatest risk then.
So you would isolate the person in your family to the back room or something?
Right. So ideally, the sick person in the family would be in a room to themselves using their own bathroom if possible, and that only one person perhaps would be the person who would come within 6 feet of them. For example, serving food, picking up dishes, doing laundry, changing the bedding, and attending to that person's needs. And the rest of the family could stay out of the room, ideally. And the ill person then could wear a mask, just a standard surgical mask if they can find one available, whenever someone is within 6 feet.
Okay, so also I'm noting dishes, bedding, all that stuff is contaminated, correct?
It is. We've picked up the virus on testing from hard surfaces. We don't know how contagious it really is. Just picking up the DNA off of a surface doesn't mean it's contagious. But we're recommending normal cleaning guidelines with extra cleaning on frequently used surfaces like tables, desktops, keyboards, cell phones, that kind of thing.
Okay, so we also know if we're sick, we should not go to work.
Or school.
Or school. And so how long do you stay home?
We don't know. We don't know how long it takes to clear. Some of the initial testing has been done off that Diamond Princess cruise ship, which provided us a petri dish of study, per se, of these cases. And some of those cases have taken many weeks to clear the virus from their system altogether. But again, we don't know how contagious they are during that time period. So what we're recommending, at least at Santa Cruz Public Health, is before you leave your home or before you go back to work or school, it should be 3 days with no symptoms at all. No fever, no cough, no shortness of breath before you leave home.
Okay, 3 days.
3 full days, 72 hours.
So in the big picture, I know, of course, we can't do what China does and just grab everybody off the street and stick them in a fever center. But what can we do as individuals voluntarily to keep this from moving around? What would if you could get people to do the perfect stuff, what would it be?
Right. Well, I know everyone's tired of hearing about this, but wash your hands. And I know it goes without saying, but I can say that I've been in many bathrooms over the past few weeks and people are still not washing their hands. So 20 seconds with soap and water, often during the day. After you use the bathroom, before you prepare food, after you prepare food, when you come in contact with any frequently used surface.
Okay.
Use standard cleaning methods to wipe down and clean flat surfaces like this tabletop we're using. As I said earlier, laptop, keyboards, cell phones, that kind of thing that are frequently touched. Doorknobs, door handles. Stay home if you're sick. If you're going to cough or sneeze, do that into your elbow, not your hands, or into a tissue, and then throw the tissue away immediately. Wash your hands. And try not to touch your face. And of course, I'm trying not to touch my face during this interview right now. It's really hard not to do. On average, we do it 20 times an hour. So you don't want to touch your nose, mouth, or eyes with unwashed hands. That's how the virus is transmitted.
Okay, so that's what happens. Either you breathe in some little droplets, you inhale it, or you touch yourself, and that's how it comes. Okay, so now that we know how we can get it and how we can avoid it, who is the least vulnerable to this virus? Or do you have an idea?
Well, we thought that children were not getting the virus, but it turns out they are, and they just don't show signs or symptoms very often, which makes them good little vectors in our community. But at least we don't have to worry about them, for the most part, getting dangerously ill. Same with pregnant women. They tend to not be as vulnerable as they are, for example, to the flu. So what we're seeing as the most vulnerable population here are the elderly. That starts at 60, I'm sad to say. It increases with age. Some people say it starts with 50. And we are advising people of elderly bracket to stay home. Not go out at all, just stay home, have your groceries delivered, have someone else do your banking for you. Those are the folks really at risk.
So no movies, no restaurants, no concerts, stay home.
That's what's recommended at this point.
All right. Now, we also hear a lot about people with mysterious underlying illnesses could be even more vulnerable. What are those underlying illnesses?
Anything that makes a person more vulnerable to infection, so that could be heart disease, lung disease, diabetes. Smokers are at increased risk for this infection. Anyone who has a compromised immune system should also take special precautions.
Okay, well that sounds important. So people are doing all kind of interesting things in order to prepare that they think are necessary. So one of the things, let's talk about masks. Since there aren't any, should we be worried about that? How much do you need a mask?
Well, the people who really need masks are the healthcare workers who are going to take care of you when you get sick. So we really want to get the resources kept for the healthcare workers so they can care for us when we need to. And that's because
they're right in our faces.
They're right in our faces, right. And so for the general public, masks really don't provide any help at all, except they help remind us not to touch our faces. But we don't want to use resources for that. So masks, healthcare providers, when they're going to see you if you have the coronavirus, are wearing a special kind of mask called an N95. They have to be fit specifically for that individual person. And they're becoming a scarce resource as well. So overall, we need masks to stay in the healthcare system.
Okay. So let me just quickly touch on testing. We did a little bit, but are there tests available in Santa Cruz County?
There are, yes. So anyone who thinks they might have the virus and is not comfortable staying at home, if their symptoms are getting worse, they should call their primary care physician's office and let them know about their symptoms and let them know that they want to come in to be tested. And testing is available now through commercial labs.
Okay. So what kinds of things are people doing that aren't helping them, that they think are helping?
Well, let's see. That one I don't.
Oh, there's a whole bunch of fun myths.
A bunch of fun myths.
Taking a hot bath.
Yeah.
Spraying yourself with chlorine.
I'm sure there's all kinds of things that we're finding online and that folks are doing that aren't going to help. So generally, if they follow flu precautions, they're doing the right thing.
So if you decide to stay home and you don't call the doc and you're pretty much healthy, you should just take the usual stuff, just aspirin and water and Sudafed or whatever.
Just whatever it takes to keep yourself comfortable, and fever-reducing medications are always helpful for fevers.
So just so we said it, we haven't said it, but there is not a treatment or a drug or a vaccine or anything.
There's no vaccine. It's in the pipeline for development, but the experts are telling us that's a year away. They are doing some clinical trials on critically ill hospitalized patients with this virus, but that's very limited, and there's no treatment that you can just buy at the pharmacy other than things to make yourself feel better.
Okay, so just feel good sort of stuff. So
stay
you can
hydrated, drink lots of fluids, take fever-reducing medications, stay home.
Okay, all right.
Rest.
So when we talk about staying home, we've talked about you get well, you stay home an extra 3 days. So how much do people need to stock up on they need to stock up on their medicines, of course, that they take all the time, but like toilet paper, we see that flying off the shelves, and water or food. Do you need 2 weeks, 3 weeks?
Well, we hope that people are prepared with an earthquake bag, for example. And I heard someone say today, should be thought of as the equivalent of a slow-moving earthquake. I really like that. There's so much about our response to this that can be learned from earthquake preparedness. So hopefully folks have some supply of food and medication at home for emergencies like an earthquake. And so preparation for this should be similar.
Okay, that seems logical. And most of us have that. So there's not a reason to really go out and buy a whole bunch of things that, ordinarily you wouldn't need, a case of toilet paper.
We are asking folks to think about getting a 2 to 3 month supply of medication if you have a prescription medication, because we expect shortages, shortfalls of prescription medication, since many of them are made in China.
Gosh, the unintended consequence. So as we move forward, what are the kinds of things that you expect to see? I mean, you'll have to make some decisions, I imagine, in the county. So are you expecting schools to close? Are you going to close, like Italy, all the restaurants close? What kinds of things should we prepare for? And why are those important steps?
Well, we issued guidance earlier this week for mass gatherings, and we asked that folks reconsider for gatherings of groups of people of more than 50 in size. And so non-essential gatherings for work, for recreation should be canceled. And the governor issued a directive last night, which can be enforced by local law if the local jurisdiction would choose to do that, which forbids basically gatherings of over 1,000 people, special events. So that would impact some of our local events, certainly. And then people over in the vulnerable category should not be together for more than 10 people overall. And then, so forbidden over 1,000 on mass gatherings, recommended to not convene over 250 is the governor's directive.
So can you give us, so people are going, what do you, give people a good reason to do this? Why? I mean, obviously you don't want this virus, but what does it mean in the big picture? If we all did this, what could you achieve?
Well, what we're hoping will happen with these measures is that we're going to flatten the curve. So it would be a typical algorithmic curve of infectious disease. So a big steep curve if none of us did anything. And what would happen then would be that those 20% of people who don't have a mild case and need to be in the hospital, that they couldn't be accommodated because our healthcare systems and hospitals would be overwhelmed, and that would increase our death rate, frankly. And by doing these measures, we can slow that curve out, spread it out over a longer period of time, and flatten the algorithmic curve.
So that would be great. So less people would become ill, fewer people would die, and we would be done sooner.
No, it would drag it out longer with the curve being stretched out and flattened, but it would mean that our healthcare system would have a chance to keep up with the outbreak.
Okay, so we're talking about pacing.
We're talking about pacing. We're in this for the long haul. We're talking about weeks to months ahead.
Okay. Oh my goodness. So we can see now China has been in the thick of this for a long time, and now they're kind of backing up the chain, as they say, and they are reporting fewer and fewer cases every week. What do you see that as a possibility here?
We hope that that's what's going to happen here, but again, we just know so little about this virus, we don't know for certain.
Okay.
Yeah.
Well, as a public health official, what do you see as your highest priority? What are you really going after in a big way?
We're really trying to protect our elderly population. And in addition, we're quite worried about people who live in what we call a congregate setting. So people who live closely together and don't really have a choice about that. So for example, we're concerned about our community members who are in our adult detention facilities, in our jails. And so we're taking extra measures for them because once the virus takes hold there, it's going to be very difficult to control. Same in our population of persons experiencing homelessness. That will be really tough. They live really close together, and we're looking at options for hoteling cases and sheltering quarantined folks together.
Okay. Well, as a final question, what would you really like to have, if everything went the way you wanted, what would the outcome be? And is there anything we didn't talk about that you want to filter into that?
Of course, I want Santa Cruz to continue to be the healthy, beautiful place that it is for both our residents and visitors. And I'd love to come out at the other end of this with everyone healthy and well and having lost no one. That's probably unrealistic, but of course, that's my dream.
Oh, well, that is a nice vision. Dr. Gail Newell, thank you so much for being with us today and giving us your professional advice and your kind thoughts at the end there. Thank you so much.
Thank you for the opportunity.
Oh, you're so welcome. And thank you for joining us for this special report on the coronavirus.